everyone. My name is Siti, and I'm from the Association of Singapore Marine Industries, and I'll be your host for today. I would like to take this opportunity to welcome everyone to our webinar today, a joint webinar between SME, Ministry of Manpower, Fullerton Health, and St. Andrew's Mission Hospital, where we'll be sharing more about the primary care plan for migrant workers. First up, we'll run through some simple admin matters. We'll just get everyone to go ahead and scan the QR code or click the link that has just been sent in the chat box. Should you have any questions at any point of time during the webinar, do feel free to drop your questions on the Slido platform and we will try to answer them during the Q&A session. A quick run through of today's program. First, we have the opening speech by Esme. Moving on, we have the introduction session by the Ministry of Manpower. Next up, we will have Fullerton Health and St. Andrew's Mission Hospital to share more about their respective costs. After which, we'll move on to our question and answer session. Without further ado, I would like to welcome Mr. Wilson Ang, the Executive Director of SME. Wilson, please.
Hey, hi. Thank you so much, Siti. Okay, hi. Afternoon, members. Thank you so much for making time down. So just a little bit of a background. So over the past year, in fact, the past half a year, because of COVID, I think many things have happened. One of the things that got a lot of attention is really the welfare of our migrant workers. I think because of that, I think we are very grateful. MOM actually has took initiative to try to see how we can work to not only just support our migrant workers, but also how can we keep healthcare costs more affordable, because these are also some of the various feedback that actually came up as well. So as you can see, one of the product that was announced really, it's more recently on the 19th of February, there was this announcement of a mandatory primary care program that has been introduced, primary care plan. So this actually has a huge impact on the construction, marine, and process sector. So I won't go into too much detail. I think today's intention here is very simple. I think first of all is to get to hear firsthand information from MOM, how this initiative came about, and how has it evolved, and why are we doing this? And then secondly is to then hear from the authorized service provider to share a bit more about their plans and what you can do to take it forward. And thirdly, really it's an open platform to allow members as well as the larger marine and offshore community to really ask questions that you have, because I think many of you have saw the press release, and I have over the past weeks have been getting a lot of questions. So I think this is really a good platform to try to clarify any doubts that may be there. So again, once again, I want to say thank you, not just members who have attending today, but also our MOM representative, Dr. Lam, and his colleague, his team, and also the two authorized service provider for this afternoon, who actually provides a service on the Western Zone, which is relevant to many of the dormitory that supports our marine and offshore migrant workers. So I think that's pretty much it. Let's deep dive into it, and later I will do the moderation session itself. So with that, I hand back to Siti. Siti, you have the floor.
Thank you, Wilson. Next up, I would like to invite Mr. Tan Chun Jie, Manager for Medical Policy System and Enablers for Ministry of Manpower. Chun Jie, please.
Hi, good afternoon. Thank you, Amanda. Could I just check with everyone if you are able to see my slides and hear me?
Yep, we can hear you.
Yeah, okay. Yeah, thank you. Okay, a very good afternoon to everyone. So today's engagement with ASME will actually be sharing on the new primary healthcare system for migrant workers. Okay, in this session, we'll be going through two key things. The very first is the background on the new primary healthcare system, and then followed by what employers will want to know, which is the primary care plan, the PCP, administrative as well as payment details. Okay. So MOM actually revamped the primary healthcare system for migrant workers to improve the care accessibility, the affordability, as well as to strengthen the system against future disease outbreaks. Now, under this primary healthcare system, okay, Singapore will be split up into 6 geographical sectors. So looking at this map, we look at city center first in yellow, which is sector A. It will be run by StarMed Specialist Center. Then the eastern through the northern regions, which is sectors B, C, and D, will be under SATACOM Health. And the western region will be split up into 2, which is Tuas to be run by Fullerton Healthcare Group, and then the remaining area to be run by St. Andrew's Mission Hospital, which is sector F itself. Now, each sector will be helmed by the anchor operators who will provide the primary care services at the medical centers, 24/7 telemedicine, as well as rapid response mobile clinical teams for potential outbreaks within the dormitories. Okay, so for the primary care plan itself, in the PCP, what is covered would be the medical examination, the ME for work pass purposes, acute and chronic medical consultations and treatments, annual basic health screening, as well as scheduled transportation to and fro dormitories and medical centers within each sector. And all this at a price point of 108 to 138 per migrant worker per year, which can be paid in monthly installments. Okay. Okay. To also ensure that there's prudence in healthcare consumption, workers enrolled under the PCP will also be made to pay $5 per consultation at the medical centers, as well as $2 per telemedicine consult. Now, this is actually in parity to workers who are not enrolled on the PCP, whereby for each outpatient visit, the worker can only be made to co-pay up to 1% of his or her fixed salary per month, or standardized rates with that of the PCP, whichever is higher. Now, this is actually a more detailed coverage of the PCP, which I shall leave to the team's respective companies' reading when the slides are actually shared subsequently after this meeting. Now, for the PCP administrative and payment details, and this is actually the most important part, employers are to abide by the 6 rights. Okay? For the 6 rights itself, to purchase the PCP for the right worker under the right sector and the right anchor operator, buying the PCP at the right time and the right price, as well as maintaining the PCP with the right payments and the right transfer or termination. So for the PCP itself, it's actually mandated for the following groups of workers: employers of work permit and S-Pass holders who are living in dormitories or working in the construction, marine, shipyard, and process sectors must purchase the PCP from the anchor operators for your workers. And employers are to declare that they have purchased the PCP before work pass issuance. Do note that false declarations, when convicted, may lead to a fine of 20,000, jail of up to 2 years, or both. Okay? And buying the PCP for the right sector itself, as mentioned, Singapore will be split into 6 geographical sectors. Okay, so under the right sector, employers are to actually enroll your workers according to the first 2 digits of the 6-digit postal code of the residential address. Okay, so let me repeat myself again. Employers are to register their workers under the sector based on the first 2 digits of the 6-digit postal code of the residential address of your worker. Okay, so in this next slide for the table itself, if we look carefully, on the first column, it will be the sector, so sectors A to F. The second column will be the anchor operator as follows. And then lastly, for the last column itself, the first 2 digits of your migrant workers' postal code. So how do we read this table? To give you an example, if let's say I have a worker who's staying at Tuas, for example, the postal code would be 62. Okay, and so with 62, to look at the row on sector E, okay, you have to purchase the PCP for the worker in sector E. Now, if let's say I have a worker who stays at Little India with a postal code of 21, so under 21, the range between 15 to 25 itself, it will be actually under sector A. Okay? Now, buying the PCP at the right price. So as mentioned earlier, the PCP actually includes the medical examination, the ME, and we are aware that workers do go through their ME at the Migrant Worker Onboarding Center for a fair portion of them. In such instances, the employers actually will pay the onboarding package to MOM, which already includes the ME. So as such, to avoid duplicative costs to employers, the cost of the ME will be removed from the PCP for this newly onboarded migrant workers. Now, for the other workers who require ME and it's not done at the onboarding center, that this will actually be in the process flow in blue, where the cost of the ME is to be paid upfront. And after the worker is actually assessed to be fit, employers are to then purchase the PCP and maintain it moving forward as well. Now, buying the PCP at the right time, and this is actually very important for employers to please note, okay, for newly arrived migrant workers, existing workers due for work pass renewals, as well as existing workers who requested a change of employer, the employers must purchase the PCP and declare such purchases before the work pass can be issued, and this is with effect from 1st of April 2022. Now, for existing workers whose work passes are not due for renewal between 1st April 2022 all the way through a one-year period up to 31st March 2023, employers must purchase the PCP for these eligible workers by the 31st of March 2023. So you have a 1 year to phase over for existing in-flight workers. Now, in terms of maintaining the PCP, we actually recommend companies to pay this, to provide gyro payment, monthly gyro payment rather, to the anchor operators. So this actually ensures flexibility for employers should there be a need to terminate the PCP in event of transfers or employment termination. Okay? Now, talking about transfers as well as termination, we also would like to touch on the right transfer and the right termination processes. So now we know that companies actually do switch across sectors as well. Okay, so if your migrant worker switches sectors, you're encouraged to switch the PCP at the earliest opportunity according to the new sector that your worker will live in. And this is actually to ensure that the worker has good accessibility to care. Nonetheless, you may choose to remain with the existing anchor operator if there is an existing patient-doctor relationship, or if the move is only for a limited time, and to ensure that accessibility is not an issue. Okay, so when you are switching, you also will need to terminate the PCP with the existing anchor operator. So how can you do so? You have to contact the anchor operator whom you have purchased the PCP from. Okay, please note that for the month of termination, there will be no refunds. However, the worker can continue to access the care services from the outgoing anchor operator until the end of the month. Okay, employers are then also to proceed ahead beforehand to purchase and maintain the PCP with the next incoming anchor operator to start with effect from the first day of the next calendar month. So there will be no time gap in coverage between the outgoing as well as the incoming anchor operator. Now, I'm sure employers are also very interested. You may contact the anchor operators at the following contacts, which we'll also be sharing with you all in the slides after this meeting. But more importantly, we also like to strongly encourage our employers to please go to the MOM website for more information. And the website is as follows via the QR code, or you can search the following web link at https://mom.gov.sg/PCP. So within this website, there will be all the details as shared. There will also be a list of frequently asked questions which employers will have, as well as also a checker which employers can use to double check which sector your workers would belong to based on the first 2 digits of your 6-digit postal code. Okay, so this brings us to the end for MOM's sharing at this point in time. I shall hand the time back over to Siti. Amanda?
Thank you for that. Okay. Thank you, Mr. Tan. Next up, we'd like to invite Mr. Jace Cole, Senior Manager for Clinical Services from Fullerton Health. Mr. Cole, please.
Thanks a lot, Siti. Hold on, let me just flash my slide. Good afternoon, everyone. This is Jace from Fullerton Health. I'll quickly take you through some of the administrative work and processes and to introduce the location of the clinics. So generally, I think just a quick overview as well, like what Jinjie mentioned, the PCP is mandatory from 1st April onwards and applies to work permit and S-Pass holders living in dormitories or in the CMP sector. Our medical centers are located in 3 locations within Sector E. The first one is our Gao Circle Medical Center, which will be doing both GP and medical examination. So this will be our main hub center, and we have 2 other on-site medical centers which are located in the dormitories: CDPL Medical Center and Tuas View Dorm. So for these 2 on-site medical centers, they are there to mainly provide only GP services. Just to quickly summarize some of the onboarding process, we actually have our platform ready to allow company to register themselves at pcp.fullertonhealth.com. So the process is, number 1, to start to register your company on our platform. Subsequently, after registration, 1 or 2 days, 1 to 3 days later, you may begin enrolling your workers. At this point in time, the enrollment module within the portal is not ready yet. So do be patient. The announcement will be kept on the web page itself to let you guys know once it's ready. This is our main contact number and email that you guys can contact us at. Just to quickly take you guys through the this platform. This is where our registration portal is. What you can do is to actually select and register your company over here. We have actually attached a guide on how to go through the entire registration process as well on this particular website itself. So do look out for it. Yep, that's all from my side. Thank you.
Thank you, Mr. Tan. Sorry, Mr. Koh. Next up, we'll be moving on to SAMH instead, where I'll be passing the time to Ms. Tan Lei King. So, Ms. Tan, please.
Yes, thank you. Just want to do a check. Junjie, you have my slide?
Yeah, Ms. Lee King, hold on.
Yes.
Give me a while. Let me bring up the slideshow. Are you all able to see the slideshow?
No, I can't see.
Are you all able to see it now?
Yep.
Yes.
Yes? Okay, yeah.
All right, thank you, Junjie. Okay, hello, good afternoon. My name is Lei King. I'm from St. Andrews Community Hospital, a service unit of St. Andrews Mission Hospital. Next slide, please. Yes, next. Okay, so just a refresher. So SAMH, our Migrant Worker Medical Center, is in Sector F, and that's represented by that red circle over there. So you will know who or which of your migrant workers will come to us. Next, please. Okay, so we know that this is a very dynamic list, and as shared by MOM Junjie earlier on, depending on the first two postal codes of your migrant workers, where they live, the residential area, so these then will come under the catchment of Sector F. So the postal codes are represented there. And on the right-hand side, of course, we're looking at indicative areas that can range from Pasir Panjang to Bukit Panjang. As we were informed by MOM as well, the estimated migrant worker population is quite a dynamic list because it depends on where you will locate your migrant workers, accommodate your migrant workers, as well as the numbers coming through. So as of today, we know that we taking care of 67,000 migrant workers. Next, please. Okay, so we are actually the first facility that is up. We are located at Penjuru Recreation Center, and we have started operation in December last year. So this is how our center looks like. And you look at the top right, and the address is as indicated over there. We are at 27 Penjuru Walk. So we have dental consult room, doctor consult room, an X-ray facility, and on the bottom we have actually a center where we provide COVID vaccination as well to the migrant workers. We are one of the two vaccination centers by MOM to provide Sinovac vaccines. So, and at the same time, NCID does the COVID-19 serology follow-up for recovered COVID patients as well. In the middle of the photo, we have a counseling service. Specifically, this one is focusing on the mental health aspects of our migrant workers. And we do have also physiotherapists running some sessions which will provide some relief for musculoskeletal type of pain for our migrant workers. Next, please. Okay, so this is the range of services that we run. From the list of item 1 to 6, it is the primary healthcare services, which will be also conducted by all the anchor operators. On top of that, at St. Andrews Migrant Worker Medical Center, we have also some other services that's highlighted in red. So we do have the services, rehab, which is the physiotherapy, for example, counseling for mental health, and also monthly session of specialists where we will have volunteer specialists coming to our center. And on the right hand side, this is our operating hour that will be in operation from 1st April next month. Next, please. Okay, so something which a lot of us here are very interested in. So how do you sign up for the PCP? The workflow over here is when our corporate portal is ready, which is actually slated for 1st April. Meantime, we will be able to start onboarding our migrant workers from employers like yourselves here with effect from next Friday, 18 March. Meantime, we have already been receiving inquiries either via email or phone calls from interested employers. And once this is ready from 18 March, we will be sending you instructions on how to start in terms of the purchasing the primary care plan for your workers. So meantime, looking at this flow chart, this is for the steady state flow chart. And it will start from the 18 March as well. So once you let us know that you are interested to buy the PCP, between the two of us, we will have a contract signed. And then, of course, our center will be able to issue you a corporate account. And with that, you will be able to log into our corporate portal. This is from 1st April onward, and then pay using Pay Now. Okay, the e-gyro capability will be ready only sometime middle of the year. But meantime, we will proceed with Pay Now as a payment mode. So once that payment is done, you will be able to download an Excel template. And from there, this is where you will start populating all your employees under this plan. And then that's how we will be able to register your workers under this plan. And with that, as a confirmation, our portal will be able to send the SMS to your employee. That's why handphone number will be one of the information, critical information that we will require, and they can start to download the mobile app. Next, please. Yeah. On top of the providing primary healthcare at the medical center, there will also be a telemedicine service, and we are partnering with this provider called Doctor Anywhere, who will come under the SAMWMC umbrella, and there will also be the capability where if telemedicine service is required, then the worker will be able to book an appointment via this mobile app. Okay, next. At the same time, okay, we are looking at partnering 2 GP clinics. This will be very convenient for migrant workers who are not living in the dorms but living in the community, like the HDB or some private residential properties. So these 2 clinics, this is the indicative location as well. We are unable to share more details at this point because we have yet to sign the contract. Once this is formalized, we will be able to share with you the clinic information. Next. Okay, so how do you contact us? Remember, we say that from next week, end of next week, 18th of March, that's where we will let employers know the instructions and the document to fill up. So you reach out to us in two ways. Either send us an email and or you can call us at this number. Next. I think that's the end of my presentation. Thank you.
Okay, thank you so much, Ms. Tan. Moving on to the next segment for today, we'll move on to the Q&A session where I'll invite Mr. Ang, who will be the moderator, to kickstart the session. Mr. Ang, please.
Hey, thanks so much. And thank you so much again, MOM, as well as the two anchor operator for sharing. Really appreciate that. Okay, quite a few questions I've gotten in. And also since I just wanted to check for MOM colleague, Dr. Obi, to be answering questions. So we will just also invite
I will take most of the questions, yeah.
Okay. So if available, if possible, the panelists probably like to invite you guys to turn on the camera so we can actually see you as well. Okay, I thought that I just want to also bring a little bit of context. I think when this press release was pushed out, quite a handful of members raised concern, but equally I was actually quite worried because a lot of our members seems to not sure what is going on and didn't really take notice. So this webinar is going to be very helpful. And again, thank you, MON colleague, for allowing us to do this so we can clarify some stuff. So being a moderator, I'm just going to take the liberty of being a moderator at this point to do the first question. Maybe, Dr. Lam, just for everyone's context and understanding, maybe can you give a little background, like how did this thing came about and really the intention behind this whole thing, if possible, just to add some context to it as well.
Yeah, okay. Yeah, thanks, Wilson, for the question. So I think we are very thankful for ASME to invite us to share with your members on this new development, which is the primary care plan and new primary care system. I think that the impetus of ensuring accessibility and affordable care for migrant workers really came from our experience through COVID-19. As you can see from COVID-19 at the beginning, where care was a bit more fragmented, we have seen how it can lead to large outbreaks within the dormitories, as well as in some of the settings within the CMP sectors, and that led to work disruptions. So what we want to do through the new primary care system is that we are looking at two things. One is that we are looking at to ensure that there is good public health surveillance for us to preempt large-scale outbreaks and to mitigate such risk, so that we don't end up having large-scale work disruptions in the future. So that is the first objective. The second objective is really to provide a peace of mind for both employers and workers when they do need to assess primary care for migrant workers. So primary care covers both acute conditions. This is like your usual fever, cough, diarrhea, a muscle ache, right? As well as chronic conditions, which can be overlooked. So these are like your high blood pressure, diabetes, and high cholesterol. If we are able to control chronic disease, chronic conditions well upstream, that can actually help to minimize the risk of complications that can lead to very high cost specialist bills later on. So the intent is to provide peace of mind for both workers and employers. And then the second one is to also minimize the risk of large outbreaks that can lead to work disruptions. Yeah.
All right, cool. Thank you so much again for explaining. Really appreciate that. So, okay, with that context, because the reason why I've also asked this question is largely because I see a few questions popping up in the Q&A side that actually ask, why is this happening? Why do we need to do this? So I hope Dr. Lam's sharing actually provides some sort of context. So now jumping into very specific, there are some questions I'm going to try to lump together and I'm going to ask and open out, including the AOs as well. So one of it is company who asked, they already bought a medical insurance for all their workers from one of the service provider, in this case, Fullerton. In addition, is there still a need to buy this PCP, or is there a transition if they already bought, especially for new workers that just came in?
Yeah. So we recognize that some of the employers would already have existing relationship with insurance as well as with GP providers. So if the insurance have already been bought before 1st April, and that the workers' work pass is not due for renewal within this year, which is from 1st April 2022 to 31st of March 2023, there's no need to transit to PCP yet. This is for your existing in-flight workers, but all workers should have a PCP by 31st March 2023, which is 31st March next year. So because we recognize that a lot of the existing healthcare insurance or relationship is usually 1 year contract. So this 1 year grace period for existing workers, where they have to have PCP by 31st March 2023, caters to such a situation. Yeah.
Thank you so much. I just got a question I asked saying that, does the PCP cover hospitalization and surgical procedures? Maybe any of the AO, you want to just share a bit more as well?
Yeah. Actually, I can also share on this. Yeah. Okay. So the PCP is a primary care plan, so it covers outpatient primary care services similar to what you will see in a GP setting or a polyclinic, right? For hospitalization and migrant workers are already required to have a medical insurance coverage. So this was also recently announced, where the current mandated coverage is at 15,000, and there are plans to actually increase it to 60,000 later this year. So both actually complement to ensure that there is sufficient coverage for migrant workers in terms of their outpatient care and their inpatient care.
Right, so it's a complementary set. So for currently, I understand it's the inpatient, which is hospitalization and surgery, is up to 15 grand. Whereas
Yes,
for
that's right.
this primary care plan, is really focusing on only the outpatient support, correct?
Yes, that's right.
Okay, I think that actually provides quite clarity of what it covers. I think a few questions quite similar on that itself. So I'm also looking through a list of a few other questions here now as well. For the workers, how do they make an appointment, or can they just straight walk into the AO itself?
Yeah, so we actually do recommend. I mean, after I answer, the anchor operators can weigh in as well. We are actually working on having a seamless user interface for migrant workers, and that will be available on their FW Mum Care app. Once the employer have purchased a primary care plan with one of the anchor operators, this will be reflected on their FW Mum Care smartphone app, and it is then linked to the functions for the anchor operators, for example, telemedicine or appointment booking if the worker requires to see a doctor physically. So the user, the system of engagement will then be through the FW Mum Care app, and then we have links to the various anchor operators. Walk-ins are acceptable because for primary care, there could be walk-ins as well. And we do anticipate that most of the walk-ins perhaps will be from workers living in the community. Yeah. I can pass on to maybe Fullerton or SAMH if you have anything else.
Do you have anything
Yeah.
to add?
Yes. So making appointment. Sorry, I was so sorry, clicking on the wrong button. Yeah. So making appointment can either be through the FW Mum Care app, which this at steady state that should be the endpoint actually. Yeah. So there's a common entry point.
Thank you. Jace, anything you want to weigh in a bit?
Yeah, can you hear me? Yeah, thanks, guys. So I think just to add on to the portion regarding the appointment booking, generally there are two ways to go about making appointment. One, from a company standpoint, when they make bulk booking for their employees, especially those going for medical examination. So our platform will get ready to allow companies to even make this kind of bulk booking, and also on an individual level, when migrant workers go through the the care app from MLM to actually make a booking, so that the bus services will actually pick them up from the dormitory that they stay in and head down to our regional medical center, or the hub center we call them. Yep. So this will be in place. Yep. That's all. Thank you.
Thank you. I just want to jump on again based on what you guys have answered, because I have this question similar. We have companies asking, is there the limit on the number of visit or expenses which of the anchor provider will cover? Maybe you guys want to weigh in as well, the AO, for your respective areas.
Maybe I can start first. Yeah, so the primary care plan is structured that there is no cap on the visits in terms of acute and chronic care needs. And this ties in with the conditions such as acute and chronic conditions that I've earlier mentioned. And the treatment will be based on the standard medication, and as well as if there's a need for simple diagnostic imaging. X-ray facilities are also available at the Hub Medical Center. So all these are covered within the PCP. Yeah.
Oh, that's actually very helpful. Thank you so much. Lei Keng, you want to say something as well? You are mute.
Yeah, so for the primary, that core, basic core level, that will be unlimited. Dental, that will be as charged, as they come. For the mental health counseling, it's actually no charge at this point. So really, it's as much as we can help workers who may benefit from these services, they may come to us.
Thank you. Jace, if not.
Yeah. Just to reiterate the point that they mentioned. So generally, like what we mentioned, GP visit, there's no cap to it. We will deal with chronic illness such as diabetics and even hypertension and all. We will take care of them. And also even for GP visits, there's no cap to the sum. I think even if let's say there's workplace, I think the next probable question will be workplace injury, right? So depending on the severity of it, if it's small cuts and all, we generally can do some wound dressing at our centers. But I think for more severe injuries where the cut might go slightly deeper, which may severe a nerve or something, we always recommend them to head down to A&E immediately. Yeah, so this is just to re-emphasize some of these pointers. Thank you.
Thank you so much, Jace. So again, I want to also acknowledge MOM colleague for actively trying to answer some of the questions in the chat itself. So thank you so much for that. Okay, I'm trying to pick a few interesting questions that may not be answered yet, so the rest can also know, but also some interesting one that was answered so that the rest can not repeat the same questions. So I noticed this, if there are companies who actually have coverage now that are actually way exceed what the primary care plan has provided, can they continue to do their own, or they have to come back to the PCP as it expires?
Yeah, so they will have to get the PCP when the work pass is due for renewal for existing ones. But we do encourage employers to review the medical benefits. So the additional benefits that you think the workers should get can be seen as similar to that of a rider. So if you mirror that to how we have structured MediShield Life, MediShield Life provides the basic insurance coverage for all Singaporeans and based on the subsidized care at the class B2 or C ward. But if you feel that you need additional coverage to class A or to cover even private hospital care, then you may have an add-on rider. So we see the PCP as a base, and it is already very comprehensive, and with a no cap on the acute and chronic consults. There's also 24/7 telemedicine and the ability to manage public health outreach through mobile clinical teams. So it itself is already very comprehensive. But if companies or employers feel that there's a delta, So if no worries. So if companies feel that there is a need for Delta to have better medical benefits for the workers, that they can always have an add-on on top of the PCP. Yeah.
Okay, so building on good employer, we do see some employer actually would like to not allow their worker to have a co-payment. Basically, they would like, if let's say the worker go and see the doctor or go to get the services for any of the AO, can the charges of this co-payment be directed back to the company?
Yes, so if it is a mutually agreed arrangement where the employer prefers to absorb the co-payment for the worker, that can be arranged. Yeah, but the likelihood is that the anchor operator will charge the $5, and then they can claim back from the employer. Yeah.
Right. Okay. So now going back to about the renewal just now you've mentioned as well. In the marine sector, some workers actually have their contract for 2 years. So we talk about having 1 year transition. So before they need to renew, it's actually 2 years period and they just started. So what happens after that? Because their agreement with the insurance or in fact the current coverage is already 2 years. Do they need to transition by 31st March then?
Yes, they will need to transition on 31st March as well, even if the work pass is not due for renewal on that date. So 31st March is the end of the 1 year grace period. Yeah.
So in that case, just to find out as well, for those coverage for let's say we have worker on a PCP, halfway they leave, I realize that the invoicing or the payment is on a monthly basis. Doesn't mean that if the worker leaves, it's prorated, so they don't have to finish paying for the whole term.
Yeah, so how this will work is that if the worker leaves for the month, because it's going to be paid through the monthly installment, the month's fee will not be refunded, but the worker can access the care all the way to the end of the month. Once it is terminated, there's no need to pay for the next month onwards. Yeah,
Okay. So that means it's almost like prorated, per se.
that's right.
That's that. All right. So I'm also seeing here there are two interesting questions, somewhat related. One is about pre-existing condition, will it be covered? And secondly is also, let's say a worker requires some sort of long-term medication, would it be covered part of this PCP itself?
Yes. I will answer the second question first. If the worker requires long-term medication, it depends on what this long-term medication is. If it is meant to treat his chronic condition, it is not something that is based on specialist care, and it is a part of the standard medication. It will be part of the PCP, right? What I mean by specialist care, it could be someone with renal failure, kidney failure, right? Someone with heart failure, right? That may require a higher end medication that is non-generic in nature and requires specialist follow-up. Then that is not covered under primary care plan. But if someone has heart failure but is already being managed at a primary care setting, and it is using standardized drugs, then they can be part of the PCP. So that clinical assessment will need to be done. So it is really pegged to where the level of care is expected to be. Is it at the primary care level, similar to that of GP settings or polyclinic, or is it at the specialist level, which is where you will see at the hospitals, right? The first question was on what was the first question again? Sorry.
Oh no, in terms of, so kind of one is existing condition and the other one is
okay. Yeah, thanks. Yeah, so existing condition, if the worker have an existing condition that is to be managed under the primary care setting. For example, if the worker already have diabetes, right? They can transit to the PCP and they'll be covered. Yeah.
Okay. And what if a patient have to go to A&E? This is kind of, we can assume it's also covered.
So A&E is not covered under the PCP because A&E will be at the start of the hospital care, where there will be appropriate triage and as well as a treatment for emergency cases at the A&E department. Yeah.
All right, because that will be classified under inpatient and hospitalization already, right?
It will be the start of the hospital care. Yeah.
Understand. Thank you so much. I have just a few questions keep coming out in terms of the pricing issue. I think there are also comments about whether is there like a monopoly. So maybe Dr. Lam, you can share about how these operators were being appointed, in what process, so that at least everyone has a better idea. And also in terms of pricing, I think just to share as well with the rest of context, when it first came out and now, I think MOM has tried to do some corrections. So maybe Dr. Lam, you can share a bit on that.
Yeah, thanks, Wilson, for the question. So I think this is a common question, and it's a relevant one that we have been getting from the various trade associations as well as employers. So what we have done for this primary care system is that an open competitive tender was launched, right? And why we have called an open competitive tender is to actually try to get the best price for the employers from the market. And hence, we decided on an open competitive tender to do that. And because it is through an open competitive tender and there are various sectors involved, there is a variance in terms of the different sectors. There are two reasons for this. One is that the volume catchment of workers staying in each of the sector may be slightly different. And two is that the number of centers or the infra requirements required may be slightly different depending on the geographical spread of the sector. So that's why there is a variance across the sectors, because it was through an open competitive tender to get the best price for employers. And also at the same time, there are sectorial differences between the various sectors, and that led to the variance. So what we have tried to do is to narrow that variance as far as possible, and also worked with our various anchor operators to do that. And for the various sectors, the range is between 108 and 138. Yeah.
Thank you so much, Dr. Lam. So there was this question that came out just now. I forgot where it is, but let's assume that a worker is at sector, let's say the sector under Fullerton, and in a situation because employer is moving their location to somewhere else. So let's say under SACH, how does it work? Do they still go back to the SACH? Do they go back to Fullerton, or are they supposed to go at SACH? And how do they inform the operator about it?
Okay, so I think it really depends on the whether the move is project-based, temporary, or is it a permanent move. No? If it is a permanent move, we do recommend that the employer terminate from the existing anchor operator and purchase a new PCP from the new anchor operator, uh, based on where the worker lives. But if it is a project basis or temporary in nature, and that accessibility is not really an issue, that means the worker can always go back to Fullerton, which is the example that you cited, to seek care, then that is fine. The other plus point about the various anchor operators, and also what Lei King alluded to, is that there will be a spread of clinics available as well. So these clinics will also be listed on our website. So for example, Fullerton has a network, and if you have purchased the PCP from Fullerton, there may be other clinics that your worker can access under the PCP. And the same, there is no added cost on the employer's end, and for the worker, they will continue to pay $5 per visit based on that arrangement. Yeah.
Thank you, Dr. Lam. So I have this interesting question. So there was saying that, okay, I saw this question again. I forgot where it is. A lot of questions been popping up. Is there is actually because now to report sick is using the FMOM Care app, right? To report sick. So if a worker is not very savvy and doesn't really know how to use it, all the different functions, they know the basic one, of course. Is there a way for the company HR to support or help to schedule an appointment to facilitate the worker to go to their so-called service to the AO?
Yes, that is available. So the more traditional way of scheduling through phone calls will still be available for the various sectors. And in fact, that is also one of the routes that we have today under the medium-term plan, where we have the various regional medical centers, and there is a certain number that either the dorm operator or employers can call and have their worker seen at the various regional medical centers. So this phone line, it will still be the one of the base for appointment scheduling. Yeah.
And the language-wise shouldn't be an issue, is it? It'll be English, or they have their local language?
On FW Mum Care app, it will be translated to the various languages. But for the phone call, it will be based on the operator. You will be likely English. Yeah.
Okay, understand. I saw this interesting question saying that annual health screening. So for this primary care plan, does it include the annual health screening, or health screening is a separate thing altogether? And the same person
Yes.
asked the second question as well, saying that they have workers on different locations. Can they consolidate to go to one?
Yeah. So it will be okay. So I will answer the first question first.
Yeah.
So that the annual basic health screening is included as part of the primary care plan. But this basic health screening mainly looks at chronic diseases. It includes things like ECG, checking your blood sugar, cholesterol, etc. It does not include things like cancer markers, etc. Yeah. So it is a basic annual health screening that mirrors what locals get in terms of the Screen for Life program.
So
The other,
before next one, I just jump in a bit.
yeah.
For this annual health screening, is there a need for co-payment as well? Still $5, or actually it is part of the whole package. There's no need for a co-payment anymore.
There will be that co-payment as long as there's a visit done. Yeah.
Okay.
Yeah.
Got it.
Okay.
So the pockets of workers and then consolidating. The second question.
Yeah. Yeah. So for the in terms of how we have planned for it is that the workers should be enrolled based on their residential address. This is with the intent to actually help to build a patient-doctor relationship over time, especially for management of chronic conditions, and even to encourage appropriate health-seeking behavior, so that a worker have some relationship with the anchor operator near where they live. Why this is done is because based on a lot of literature or evidence that having a family physician or a doctor near where people live, it actually helps with health outcomes. And in fact, that is also partly why MOH recently have also announced on the enrollment of even Singaporeans to one family physicians based on where they live. Although on the local side, it is still work in progress, there will be further consultation. So in terms of building that patient-doctor relationship, the enrollment should be done based on where the workers live. Yeah.
Okay. Doctor, I'm sorry, I'm just jumping in a bit because earlier you mentioned that per visit there's a need for a $5 co-payment. I think I saw somewhere, I think one of the colleagues posted saying that the annual health screening don't require co-payment. So I just want to make sure that which one is correct, because I saw the reply from one of the colleagues. So
Yeah, yes, Wilson. So Priscilla here, I just wanted to clarify that $5 co-payment is only for medical treatment.
Okay.
Yeah. So if there is if the visit is just for health screening, then there is no need for the co-payment.
Okay, cool. Thank you so much for that clarification. Okay, quite a few more questions that came up. If should an employee being treated at the anchor operator for normal ailment suddenly has a heart attack and unfortunately died, what kind of scenario are we looking at? It's interesting. I thought it was something that should just raise up.
Sorry, can you repeat that again? If yeah.
Well, the occasion that the employee is being treated at the anchor operator for normal ailment, all of a sudden there's a heart attack, then what would it be? What the scenario be like in terms of who's the cost, what are the additional costs, or actually everything is covered under the primary care plan?
No, so I think it will be separate issues. I mean, if the worker is there for the primary care originally, right?
Yes.
And then that would be, of course, covered under the primary care plan. But if he actually did develop chest pain and signs of a heart attack at the visit, then he will need to be escalated, right, to through 995, and the ambulance will bring him to the nearest hospital for further care, right? So then that will be covered for under the hospitalization part of the house. Yeah, but he will be escalated because for heart attack you will need to have intervention at the tertiary or the specialist level. Yeah, it is not something that can be managed at the primary care setting.
Understand. Thank you so much for that. So I keep seeing this thing on dental. I may have missed out, but is dental coverage part of it? I understand it's not, right? Dental.
Yeah, dental is not part of the PCP. It's not part of the primary care plan, but we have made dental services available as what Lei King has shared, and there is a payment involved at dental, although it is slightly lower than what you would expect in a community dentist. Yeah, maybe I will let Lei King share a bit more on the dental. Yeah.
Okay. Linking, I think you're on mute, is it? Let me see if we can help you unmute. Give me a sec. Oh, strange. You are not on mute, but we can't hear you. Let me just try to mute and unmute again. Are you able to say something? No. Okay.
I think now she's muted. Miss Tan, maybe you can try muting and unmuting yourself again. I think there's some technical difficulties here.
Okay, meanwhile, in that case, I think I saw one of our fellow presenter, Yuan Ching, raise your hand. You want to say something? Yuan Ching? I saw the hand raised up, so I just wanted to check. If not, okay. Then I'll just go back to the various questions that was being raised earlier. Okay, it seems like a lot of these questions has been raised up, I think has been answered. I'm just trying to scroll down because there's really a lot of questions. Okay, some of it repeated. Okay, so this one question came up. How in advance should employer inform the AO about the changes in their employees' status?
Yeah, I think as long as the employer knows that the worker will be shifting location, they can inform the anchor operators, because it is on monthly installment basis. So the termination and purchase of the next PCP is made simpler that way. Yeah.
Okay. So basically it's a monthly, it's prorated based on the month last. It doesn't go down to the day. So long as it's done within the month, it should be fine, essentially. All right. So private, this one I'm not sure if I heard it. It's private specialist treatment. If the AO refer them to any of the specialist treatment that's outside of the AO coverage, it will also not be covered, right? I guess, for specialist treatment.
Yeah, so specialist treatment are not covered under the primary care plan. As mentioned again, so the primary care plan covers care similar to that of the primary care setting, like the GP setting or the polyclinics.
Okay, thank you so much. Yuan Chin said that she cannot, Yuan Chin, sorry, I'm not sure if male or female, but Yuan Chin mentioned that cannot speak. I'm trying to see if we can mute or unmute. I'm just going to check with my colleague. Siti or Amanda are able to help to unmute Yuan Chin? Or
Actually, we gave the rights already. Maybe you can try. Yuan-Chin, can you try to unmute your mic to see whether you can actually try to speak? Because we gave you the rights already.
So again, I'm mindful of the time. Probably give ourselves about another 10, 15 more minutes. I think as the question after this, we'll try to consolidate. And we also will then run through both the AO as well as MOM colleague to put together a Q&A, especially some of the questions raised today and also those that were not raised. So just again, don't have to worry. Also, in addition to that, we'll also be sharing the slides with you guys. So at least you have a better idea as well. I think one of the challenge I heard some of my members is that when it was announced, I think they didn't realize it. Having these slides that was presented again by MOM colleague was very useful. It gave a lot more clarity as well. Okay, so I'm buying time, so I'm now trying to check with Yuan Chin again. Yuan Chin still can't speak apparently. So okay, no choice law. Then you just type your question. I'm sorry. Unfortunately, we can't. Let me just try. Mute, unmute. Seems not to be able to. Oh well, let's move on to other. Is there anyone else wants to raise any question? I'm just wanted to check because we can actually unmute, let you unmute, and maybe one or two of you guys to ask any questions. Anyone? Nope. All right, then I'm going to go and search at the question. All right, so I see questions saying like $5 co-payment, what kind of treatment? This part, I think is a, like what Dr. Lam mentioned earlier, is a very standard outpatient kind of treatment, correct?
So it will cover the $5 is based on the primary care kind of medical treatment. I think Priscilla also shared earlier. So it will be based on the services that is required for acute and chronic care. So example of acute can be your runny nose, cough, fever, diarrhea, headache, muscle ache, you know, and chronic conditions will include things like high blood pressure, high cholesterol, or diabetes. Yeah? So all this is a standard co-payment rate of $5.
Okay, understand. I see this gentleman, or is it lady, I don't know, Kwok, want to actually raise questions. So I'm going to allow Mike. So Kwok, you can unmute your mic if you like.
Yeah, hi,
Kwok?
sorry, yeah, can you hear me?
Yep, can hear. It's a bit soft, but you need to speak up and a bit slower if possible.
Okay, I just want to share, right, just now you all mentioned that any point of time we can readjust the manpower for the PCP plan, right?
Yeah, basically, are you asking that if you have change in manpower, can you adjust accordingly for the primary care plan? Am I right?
So my question is that if let's say I want to add in more headcount or want to remove the headcount, how do I go about it?
Okay, how do you, I just want to check panelists, you're okay with the question? Anyone wants to jump in? Thank you, Kwok.
Yeah, so if there are new workers that are brought in, you will have to buy the PCP from the anchor operator. And if there are workers that have completed their contract with you, then you can terminate the PCP. Yeah.
So essentially, we can add and remove anytime. So long as you just register with the anchor operator based on the process that was shared earlier to add.
Okay, so in short, right, I just need to, when I want to add in or want to remove the workers, I'll just send an email to the anchorage operator, then they will proceed with the procedure, right?
So I think each of the anchor operator have in their slides, which we will share at the end of this webinar on the registration process. You can follow through based on that process to register. For termination, they will also be sharing how to do that, and it will be quite simple in the way that because the primary care plan is paid on a monthly installment basis. Yeah.
Right. I hope that answers your question, Kwok. Thank you so much. Okay, I'm just checking. Anyone else has any questions you'd like to raise using your voice?
I have been let in back into the webinar. Can you hear me now?
Yes, Leiken, we can hear you.
Okay, yeah, I just want to address the earlier question on
Please.
dental. There's a lot of interest on dental.
Please do.
Just want to share that the PCP does not cover dental, and as I shared at my presentation, this is an add-on service. Our dental service is actually heavily subsidized by donations. Hence, that's why we are able to keep our cost down. So for now, there is actually a very high demand for this service, and that's why we are going to keep this to Sector F for now because we are just clearing the waiting list. So for typical basic simple procedure at this point in time, we're only just charging out of pocket $10 only. Then maybe the more complex one will be about $20-$30. So this is just for you to have an understanding where and how the dental service charges are. Thank you.
Thank you, Leiken. It's true. The dental service at the price you shared is actually very affordable. So, okay. I this question that actually came up as asked as well, saying that so the co-payment, it's the whole part of the whole system, co-payment is make it mandatory, right? But companies can feel free to absorb it. Company has also the right, not there's no need for them to actually absorb this $5 co-payment. Am I right saying that?
Yes, there's no need. So if the the $5 co-payment is a feature of this PCP, and if companies want to absorb it, it will be based on the mutual agreement. But if not, then it will be based on the feature of the PCP. Yeah.
I think just maybe to weigh in a bit, I think during the feedback session, I think one of the things why this is being put in place is also ideally trying to avoid people from abusing the system. And subsequently, whether the company decide to help to cover or to absorb it is really at the company's prerogative. Right. Okay. Sam, right. Sam, let me allow Mike. You can unmute yourself, Sam. Sam, can you can unmute your mic?
Can you hear me now?
Yes, I can hear you. We can hear you.
Okay, Dr. Na, my question is this. I actually asked it earlier. I typed it and then I think Priscilla answered it already. Question is, you mentioned that at the end of this year, you will make it mandatory for these migrant workers to have a $60,000 insurance for the foreign worker medical insurance, right?
Yeah, this was recently announced at the recent budget debate, that the coverage currently there is already mandated, but the coverage is at 15,000, right? But the coverage will be reviewed and to 60,000 towards the end of the year. Yeah.
We already have about $50,000. We for our workers, we already buying the 50,000. We're not buying the minimum of 15,000. My concern is when you make it 60,000, right? We're already paying about close to $200 for that insurance. So my concern is, or rather my suggestion is, if you can do something like this, similar, everybody goes to one, like a group insurance, then our cost will be lower. If each of us go to one broker, to a separate insurance company, I think the cost is going to be very high for a $60,000 policy. And when you do that, right? When you work with one insurance broker, or what will happen is when you have claims, then the next year your premiums are going to increase. So my suggestion is, if MM is going to do this, okay, it's good because the workers. I mean, for the companies, it's also good for the companies, but the cost will be high. So the thing to do, if you do like this, something like this, group insurance, then cost can be lower, and we probably can end up paying less for the insurance.
Thanks, Sam, for the feedback. We'll definitely share with the team looking at the medical insurance. But also just to add that there are a few measures that the team have introduced to ensure that the premiums will not is kept affordable. So one is that there will be age differentiated premium. Those 50 and above and those 60 and below, it will be different. Likely. And then two is there's also standardized exclusion clauses, meaning certain things will be excluded, similar to how the MediShield Life for locals have been structured. So hopefully with these measures, that can also help to keep the premium affordable. But we take your point. We can share it with the team looking at medical insurance. Yeah.
Sorry, Dr. Lam, just to thank you so much, Sam. Sorry if you don't mind me
Thanks.
jumping in. Dr. Lam, so in this case, as an association, we can also check in with our member, consolidate feedback, and actually bring it up to your end, right?
Yes, definitely. So I think we appreciate such engagement sessions as well as webinars organized by the various trade associations. In fact, as we journey the policy design, it was also with the various feedback taken, right? And the policies will never be standstill, right? There will always be continual review to make it better and to balance the interests of the various stakeholders. So we encourage the various employers that you can continue to share feedback, perhaps through your association, in this case, ASME, and then we can always work together on some of these issues. Yeah.
Right. Thank you so much, Dr. Lam. Thank you, Sam. So after this, probably the insurance, because it's a whole different conversation altogether, we'll probably need to do a separate engagement on that. So coming back to this primary care plan, I think we're also ending our session already. But one of the last question, I think I have a few text messages that has been asking me, the pricing. I mean, it's already between 108 to 138. Is there a possibility in due course to work a way to reduce the cost? Because I think with everything going up nowadays, this every dollar counts for our members or companies. Is this something is still open? Because as you mentioned earlier, there's some it's an ongoing revision. So is this something that companies can expect as well? Sorry.
Yeah, so we will be reviewing the prices regularly. Yeah, so I think that will definitely be taken into consideration when we do our review next, as well as the feedback from the various trade associations. Yeah, so the prices will be reviewed in due course. Yeah.
So that means as companies uses the PCP along the way as an association, or in fact, I'm sure companies can reach out to MOM directly, but we can help to consolidate some of the feedback to see how we can improve this thing itself, both in terms of quality as well as in terms of the cost, I guess.
Yeah, so in fact, we will encourage that because I think you will definitely provide the ground feedback that's very important for us in shaping policies and making tweaks. Yeah, so I think we will definitely benefit from the feedback through ASME in actually looking at ways to improve it further. Yeah.
Right. Thanks, Doctor. So I'm mindful of the time as well. Even though we cater a bit more, I think there's a lot of questions. Some of it already started. For what I see, is already repeating. So again, thank you, MOM colleague, for trying to answer it. So to kind of wrap it up, I just want to just check with the AO. Do you have any final words before I go to Dr. Lam to close it? But Lei King as well as Jace, do you have any things that you want to raise, especially from your end as a AO itself?
Yeah, so we encourage those who are where we are, your AO, the contact numbers and the email address has been provided. So just drop us a line and we will be contacting you by next week.
Thanks, Lei King. How about Kwok? No, Kwok. Jace, sorry.
No problem. Thanks everyone. I think we look forward to serving your guys, and I think as the inquiries are coming in fast and furious, we will do our best to address it within 3 to 5 working days as soon as we can. Yeah, I think seek your understanding on this. Thanks a lot.
Thanks. And then Dr. Lau.
Thanks, Wilson. So I'm really thankful that for ASME for organizing this webinar for us to share with the employers on the latest plans. I think the interest from the various employers in getting the PCP actually shows how much the employers actually care for the health of the workers, and do bear with the anchor operators as they work through the onboarding process together with you. And I hope that the employers as well as workers will see this as a long-term relationship as we build towards this patient-doctor relationship for better health outcomes. Yeah, thank you.
Thank you so much, Dr. Lam. And again, thank you for MOM colleague and the 2 AO, as well as companies in the marine sector, as well as members for attending. So again, I want to urge all of you guys, if you have any more further questions, you can email. But at the same time, earlier, my colleagues have shared some of the links. Basically, the Slido link. Continue to post your question there. We'll consolidate at the end of today. We have also other questions already coming in. So let us put it together. Give us about a week to come back with all the FAQ. But in terms of the slides, we'll try to send it out ASAP so that at least you have time to prepare and inform your HR as well. So with that, I think I would like to give me liberty to draw a conclusion for this. I just want to check in with my colleague, Siti. Do you have anything else? Or we can just call it a day?
Sorry, yeah, I think that's all from me also. Just wanted to mention that the sites will be shared again. So afraid not again. Yeah, but other than that, there's nothing else from me.
Thank you so much.
If you have any questions, you can drop it into the admin@SME email.
Yeah, and also put your question on Slido as well. So the secretariat end will consolidate. And in terms of the earlier mentioned by Sam, the insurance, the coverage from 15 to 60K, I think that's a separate conversation. Let us work together to consolidate some of the thoughts and views of it, and then we can bring it up accordingly. So that's what we can do as your association. So again, thank you so much everyone for your time. Have a good Friday and have a good weekend ahead. Right, take care everyone. Bye.
Thank you. Bye.